There are 3 types of YCC visits: routine, blood, and clinical, as well as scripting. Each visit and scripting needs preparation in order to ensure that it runs smoothly and to avoid wasting time. As the counsellor, make sure these 7 things happen before the YCC begins. The YCC register should be up to date. Read through the YCC session plan and know the material well. Choose an icebreaker and make sure you have any materials you need, like pens and paper. Check with the YCC clinician that they are available at the session time and that the ART refill pre-packs are ready. Book an appropriate venue. Have the screening tools for TB, STIs, nutrition, contraception, and psychosocial well-being, as well as a scale and measuring tape or measuring rod to measure height and weight. Call YCC members 2 or 3 days before to remind them of the session. Tell them if it's a routine, clinical, or blood visit. Draw YCC members' clinic files before the session. Remember, once you've completed your YCC, you must remind members of the next events before they leave. YCC visits are made up of 3 stages. During stage 1, the YCC counsellor screens members for TB, STIs, nutrition, psychosocial well-being, and contraception use. During stage 2, the YCC counsellor facilitates an interactive youth-focused discussion. And finally, at stage 3, the YCC counsellor gives a pre-packed medication to all YCC members with a suppressed viral load. All other YCC members visit the YCC clinician for a fast-tracked consultation. Any YCC members who screen positive will also be directed to a counsellor or clinician as needed. At the end of the routine visits before the blood visits, make sure that the YCC counsellor tells all members that the next session will be a blood visit, and so it may take a little longer than a routine visit. Before each blood visit, the clinician should prepare everything for taking viral loads of YCC members and make sure to have enough time available to get all of this done. Part of preparation is completing the blood forms and placing them in patients' files. The YCC counsellor should prepare a slightly shorter discussion compared to routine visits so that the session doesn't take too long. For clinical visits, the YCC clinician should make sure that they're available and that all the latest blood results are in each YCC member's files and YCC register. YCC clinicians must keep track of when rescripting is necessary for each patient. There are 3 options for antiretroviral treatment scripting and pre-packing, and your clinic will be able to decide what works for you from these 3 options. The CCMDD delivers 2 months supply every 2 months and requires scripts every 6 months. The YCC clinician issues scripts for all members every 6 months. The clinic pharmacy pre-packs supplies before each club, and the counsellor collects them the day before the club. The YCC clinician takes responsibility for ordering sufficient medication and pre-packing it before the session. A step-by-step guide to help you plan your YCC can be found in the YCC Implementation Guide.